Chaos erupted Monday morning at a health facility in Ado Ekiti, Ekiti State after a newborn baby went missing just hours after birth. The baby, reportedly delivered Sunday evening, was discovered missing when nurses came in to tend to it. Shock spread quickly through the facility and nearby markets as the mother and staff cried out in confusion. The whole place was in panic. People couldn't understand how a baby could just disappear. One eyewitness said. Police spokesperson Sunday Abutu confirmed that 4 suspects have now been arrested in connection with the incident. Commissioner of Police Joseph Eribo ordered the State Criminal Investigation Department to take over the case and recover the baby. The arrested suspects are giving credible information that will aid the investigation, Abutu said. The baby had not yet been found as at press time. Investigations are currently ongoing. I mean, you know, when such reports come to us, you know, as Nigerians and as a woman myself, the stress of carrying a baby all of the 9 months, the extensive labor of, you know, of the delivery time frame, and you wake up in the morning and the baby is missing. What are your thoughts on this report?
Again, it's sad because this is not the first time such a thing is happening.
Right.
But the fact that it's happening, I mean, like again, just goes to show that we haven't taken this thing seriously. Over the years, we have been cases of babies being sold or babies being missing, you know, just like this. And what has been done to ensure these things do not happen? Nothing, if you ask me. What kind of security do our hospitals operate? I mean, you and I have, sure, I mean, some else is good and whatnot, but when you visit the hospital,
right,
the security is so lax. Sometimes you find that it's just an old man in front of the gate or 2 young men that are not even taking their job seriously. And when you get there, probably just open up for you and you go in. Nobody checks what you're bringing in.
But those people that when you go into the hospital, right, you said it might be an old person or, you know, someone that is just lax about the job. Basically, I didn't take this job because I need this job to show my work ethic. I took this job because I need something to feed myself, right? Now, someone walks into the hospital, walks directly. I mean, there's usually a reception stand, even if there is a back exit. When you're leaving, when the perpetrators of this were leaving the compound of the hospital, that lax security person that was just sitting down, that saw them without the baby when they entered, didn't quite still notice when they left with the baby.
I mean, that's a very...
raises more questions than answers.
Yeah, but, you know, when I have discussions about a few things going on in Nigeria,
right,
you know, people with like minds, you find out that some of these things are not so hard to rectify, fix. It just needs to start from somewhere, and it needs to start now. Now, what do I mean by that? When we have a place like a hospital, for example, bear in mind security is the most important sector in anything business, in anything society. In a hospital, for example, in a school, you need security. In a workplace, you need security. And security shouldn't be a thing where anybody can just set up a security organization and bring in young and struggling Nigerians or old, struggling aged men. What about that? I'm not saying you shouldn't give jobs to old men or young Nigerians, but they should be trained. If you have someone who's not trained, and when I say trained, I'm not saying I've worked with organizations where when you see the security, when they bring their proposals for you, oh, we are security firm, we would like to work with your organization. For example, the organization I'm working with in Lagos a while back. Okay, we take in their proposals, we review and we assess it, and we say, okay, let's see the people you have. When they bring these people from the first stages, you feel skeptical, but at the end of the day, you pick one, right? When you pick one, you find out that you, as the employee, will be the one now teaching them or trying to train them on what they should do. That is because they do not have adequate training.
So the organization
Yeah,
doesn't train their people before, you know, they bring a
exactly.
proposal to an organization
I
that they
mean,
want to work with.
exactly. So I feel like we are not taking it seriously, even as people or as in quote security organizations. Now, secondly, if you have a hospital, if I ask you now, when last did you go to a hospital and you literally had to check yourself in from the gate? Have you done that in a while?
I haven't done that in a while.
You haven't done that. Why shouldn't that be done? Why does it have to be the reception? Right now, let's just speed forward a bit. If you want, if the police want to start checking, oh, let's start an investigation. Where did they start from? Do they have to go because someone can enter the premises of a hospital and roam around without going to the reception? Do you know that?
Right, that's
I
possible.
mean, it happens. So why haven't we started taking this thing seriously? Why are people not checking it from the gate? Because when this sort of investigation, you need to know every single person that has come in through that gate before you
Right.
can even begin to pinpoint. Secondly, you find out that in some hospitals, the CCTV cameras are not even working. So these are the things we are talking about. Sometimes it's not just about when these things happen. It's about the things that have been put in place to ensure that these things do not happen. Because before someone goes to a clinic to, for example, in this case now, I mean, the kid was obviously, as obviously they kidnapped, or, they kidnapped, if I'm use that word. How do you begin to find, how do you begin to find the suspect when you don't know who has come in, who has gone out? So these are the things. And like I said, these things have been going on for years, but nobody has sat down to, I mean, there are hospitals that do this, by the way, in quotes, these are high-end hospitals. That's you are literally checking in yourself right from the gate because they
Right.
know that anything can happen. The CCTV cameras are all around. So if you're even planning to do such a thing, you would know that before you even reach the individual of the case, you have been caught. But when you know that nobody will check me in, I can just hang around and sleep in at any point. These things are, I mean, we have porous organizations, I mean, hospitals, schools alike. We just need to take this thing seriously.
Now, you said, you know, for some high-end hospitals, they enforce the fact that you check in from the gate before you go in. What do you think about if this becomes a standing order or a standing rule for anyone that wants to site a clinic? Do you think we would be able to prevent measures such as this? Especially because when people go to hospitals, most people are usually in their most vulnerable state when they, you know, go seek the help of a doctor. Someone could have been through a surgery and, you know, they're just out there. And then again, you have to, when you talked about camera, what are your thoughts as regards, you know, patient's privacy when you say a patient is probably admitted here and sometimes in pain, people don't care if, you know, their privacy is being eroded. Say they are in pain and their clothes are off their body and they're naked by the camera. What are the privacy strategies that can be used in that regard? And do you think we should make a standing order, especially with the children's hospital and the children's ward?
It should be a standing order. A very good question. It should be a standing order to have people's data taken
Okay.
from the gate. It should be a standing order that there should be CCTVs. Now, policies and privacy policies can be checked. I mean, you can't just put cameras everywhere, obviously.
All right.
So, the main places that cameras should be the gate, inside of the gate, outside of the gate, entrance or receptions, at least the public spaces where you can track and see, okay, this, I mean, someone cannot just appear into the theater room of us. So at least you can track, okay, this person came in through the gate around this time. He was seen in the reception around this time. Was seen on the walkway at the emergency wing around this time. So all those major areas. Yeah, the signing in, it could be an emergency signing, but at least, even if the person has been taken in, someone can, follow up. Maybe part of the security can still follow up. Okay, someone came in around this time, and we need to get their data, right?
All right.
And when they are checking out, you ask them questions. Oh, can you sign out? Oh, I came in during an emergency. All right, please hold on. Let us confirm these things.
All right.
It's not. It's not a prison, right? But if these things are not put in place, these things will keep happening. Right?
Sadly
So it's not for the safety and security of everybody. Imagine this these measures were put in place, these things would reduce. And even if it manages to happen, it will be easy to track down whoever has
Right.
done this. But I don't want to say anything about the case like if it's a sad thing that would be very hard to fix. But it's really hard to fix because where do you start from?
Sadly, sadly.
Babies are being born every day. What can you use to even tell that this is my baby, even if they bring the newborn baby to you right now? Because in this case, if you haven't even taken pictures,
Hmm.
maybe the hospital might have pictures or whatnot, but babies are still more or less advanced fetuses, and it's easily hard to it's just a
Exactly.
sad thing, honestly.
Yeah, really sad. Thank you so much.